Welcome back, everyone. We're now starting the fifth panel session of the day, which will look at the digital skills gap. Just before I introduce the moderator, a few reminders. You can use the chat function to introduce each other, to discuss with the other audience members. And please ask questions in the questions tab, because the panelists will then take them at the end of the discussion. So now, Alexis, I'll let you to introduce the panel session and the panelists.
Thank you very much, Claire. As an introduction, I'm very happy and honored to be your facilitator this afternoon during the Closing the Digital Talent Gap session. To make sure we cover a diversity of topics, I will ask a few questions to the audience, to the panelists, sorry. First, let's present our three panelists. First, Viktoria Katona, who is from GE Healthcare, in charge of projects. Maybe she will be more precise on her bio. We also have Stéphanie Trang, who is a CEO for EIT Health, and Christian Charbrerie from EPITA, who manages the health major from that school. A few words, introduction words. The World Economic Forum said that 50% of employees will need reskilling from now to 2025. I mean, digital skills, and internal upskilling is 3 to 5 times cheaper than recruiting and is very efficient in unemployment reduction. In France, 40 million people have a lack of digital skills, and even some basic ones such as filling digital forms. Out of unemployed people, 12% of them lack digital skills. 2/3 of companies declare having difficulties recruiting digital experts, and only 28% of them are women. In the EU, 42% of people were unable to perform basic tasks, such as connect to the Wi-Fi network or use websites. Last but not least, a study from the McKinsey Global Institute shows that if digitally lagging sectors such as healthcare use their digital assets and increase digitalization of labor, EU 28 could add 2.5 trillion to the GDP. So we have a number of topics to discuss here. First, let me ask Stéphanie and Viktoria, what are the digital skills that are most sought after by companies?
Viktoria, do you want to start?
Maybe Viktoria, you can start.
Thank you. Okay, all right, thank you. So hello, everyone. It is my great pleasure to join here. My apologies for the technical issues at the beginning. So regarding digital skills, I can talk about like what we see, what would support the transformation in healthcare that I think all the patients and all the medical professionals want to see. And skills we are searching for to ensure that the projects that we are running can really serve the patient's needs is, on one hand, the understanding of the concept of digital solutions in healthcare, and especially the concept, understanding the concept of artificial intelligence, like what it is, beside it's a black box or some sort of even magic for a few people. But so we really need people to understand like how this technology can be utilized, what are the underlying operating mechanisms in order to engage them to take part in projects, to engage, to utilizing this technology during the caregiving process, during the diagnostic processes in the hospitals. So we mostly meet this kind of need, and we sense the very strong lack of access to high quality practical AI education in the healthcare domain in the Central Eastern European region where our hub is located.
Thank you very much, Viktoria. Stéphanie, what is your point on the digital skills most sought after by companies.
Yes, thank you, Alexis, giving me the speech. Hello?
Yes, we can hear you.
Sorry, I didn't know if my mic is on or not. Yes, so Alexis, thank you. I'm Stéphanie Trang, so I'm head of AI for Health initiatives. We gather experts, scientists, research labs, medical professional, caregivers also, patient association startups within our initiative. And I would say that to answer to that question, that this is very complex because in terms of skills and digital skills, would mean cultural skills also. Our mission at EIFR is to acculturate these people, especially the professional healthcare, to the new technologies, to democratize also the artificial intelligence techno as not an outcome, but something that can be used to help professional healthcare to be better at their jobs and to make a patient life easier. So I would say that it's very essential today to close this gap, skilling in the digital way, and particularly in artificial intelligence, because now we have use case on that topic, and the skills is not only IT, it's also cultural skills on digital, what is evolving, what is going on in terms of the evolution of the job, because professional healthcare yesterday is not the same than the professional healthcare today, and even more is not the professional healthcare with using new technology is not the same than professional healthcare with not using the new technology. So there is three main skills. The technical one, to be acculturate to the job, be on hospital, see how the experts are working, and learn by experts, by the learning by doing, I would say, and also listen to patients, be user-centric and patient-centric. I would say that's the main skills, more than technical one, that I would push.
I would like to ask a question to Christian now. How do you feel the gap, the needs, I would say, in digital skills from I would say from the workforce?
So we at EPITA, we are an engineering school specialized in computer science. We were very new in medical, on the medical subject 3 years ago, but we saw from the alumni we have that there is a pool from the market for engineers on AI specifically, which is something we do for years now, and we saw, especially in the AI and imaging, an opportunity for our students. One of the big employers for our students was an American company in imaging and AI. So seeing that, we decided to split our AI major into AI and images. And so we did that 3 years ago, and we saw that both AI specialists and AI and image specialists were recruited in image and AI companies. So with that, we decided to, for once, to do a specific major on healthcare.
Thank you, Christian. I would like also to ask Viktoria, how do you feel the need in digital skills internally at GE, especially GE Healthcare?
All right, thank you for the question. So apologies, I was so excited about the question. So I'm Viktoria, and I'm acting as innovation project lead at Budapest Digital Hub of GE Healthcare. We have 500 software developers and a large data science team working on 20 global healthcare products currently, and a few dealing with artificial intelligence. So our experience is that it is a hard step for either IT professionals or to medical professionals to start moving towards the other direction, but it is a very important step in their careers. So by us, we have lots of previously medical professionals working as data scientists who trained to their new domain, and reverse as well. What we sensed that was there was a limited knowledge regarding how IT knowledge could be utilized in healthcare domain, and we come across the experience. So far since 2018, we have more than 1,700 alumni in our Hello AI program. So we really had the chance to make an impact and recruit plenty of students and professionals to create this to participate in this program. And their feedbacks were that they were pretty much interested and pretty much got enthusiastic about they got a chance to really take part in development projects, to take part in research projects where their knowledge in statistics and programming and data science can really save lives every day. And our education of the Hello AI programs focus a lot on providing a 360 view to what are the different aspects of artificial intelligence being applied in healthcare. So one aspect is providing the insights to what are the programming knowledge and prerequisites, what are the terminologies of artificial intelligence, also about the context of how this knowledge can support healthcare, and showing lots of examples of like how it looks in a career, what kind of inspiration they can receive from practicing data scientists and practicing professionals to grow to this field. And we also have strong collaboration with digital health accelerators and startups as well, where they can introduce the participants to like, what are the opportunities in 2 years' time, 5 years' time? How they should imagine a pathway of a startup. So by us, what the need that we wanted to address is to really support the regional talents with a program where they can understand the broader context and the curriculum and educational pathways regarding healthcare and AI. And so far, it had been pretty successful.
Thank you very much, Viktoria. I would like to ask Stéphanie a question now. You created the AI for Health initiative. What are the digital skills that are specific to healthcare, to your point of view? You're mute, Stéphanie.
As I mentioned earlier, there is a lack in terms of cultural, I would say, cultural and soft skills in the healthcare industry. The most important thing is to acculturate, I would say, industrials, startups, also across with industrials and also professional healthcare. And as I said, also patient associations to make them realize what is going on now in terms of new technologies, AI, and in the healthcare industry. The needs is not only in terms of make them illustrate, I would say, use case and teach them what is happening in the industry by some studies or statistics. or books. The theory is here, but they need to practice, and to practice together and to learn together. So there's different level, according to me. There's a level of I would say the academic point of view, academic level. We need for the young professional people, actors that wants to do things in that field, to make some cross-board or multiple cross-initiative skills. Why not making some Erasmus also in some field, like in the French university, when you are studying medicine, there's a lack of cross-border teaching. Why not doing some, as I said, it's a concept, but I would say, I don't know if it exists really. A Christian can answer to that question, but some cross-border, like some young medicine going to a business school, or going to 1 week to a startups, maybe more than 1 week, I would say 3 months, I don't know. But it's really important that the academic field in France and abroad can innovate in that way. The second level, I would say that experts, as I said, experts has to teach to other non-experts through some collaborations, some going through also at our events, AI for Health, to go to master classes from experts and learn from them. And also be acculturate on what is in healthcare industry, the datas, healthcare datas, real world datas also, that implies so many things in that topic. And also the IT developers, the technical data scientists, they have also to be trained on what is the job of a professional HCP, of a professional healthcare. I think for me it's the 3 points that are essentials now, and also the talents gap. Recruiting is a challenge. That's why WorkInHealth is here, and we are very proud to be an ambassador of this initiative.
Thank you, Stéphanie. I would like to ask Christian a question now. Regarding that digital skills, why did you create a specific major on health? And are there specific skills that you need to teach students?
Yeah, thank you. So I one comment on what Stéphanie just said. Yeah, I think it's very important to notice that the soft skills, and more specifically in healthcare, the ability for our engineers who are really deep tech people to speak to, I would say, aliens like the medical doctors, because they've got a strange language. It's very specific, and they are not very clear sometimes. It's not black or white. It's normally in the gray area, and our students in computer science specifically are very black or white, 0, 1, and that's strange for them. So we need to acculturate them to this language. So just to show you the steps we followed to make the major. So at first we were nowhere in healthcare. So we started with a minor, which is several hours, 12 hours of training, and we did that for our AI and image specialist. And 1/3 of them, when you look at the numbers, 1/3 of them went to go to image and AI for health. So with a very few hours of training, you can have, let's say, an impact. Not a big one, but an impact. So that was the first year. The second year we had COVID, so a strange year for for students. But what we did about 50. We did about 50 projects for the COVID. Some went well and less well, whatever. But we had contact with APHP, the hospitals. We had contacts with, let's say, some people from the healthcare industry. So that was we saw that there was traction, and to be honest, the students have changed after the COVID. Healthcare was, let's say, not in their radar before the COVID. Now it's a real subject, A, and B, they can see the impact. So they saw that the people that were in that field had a huge impact, and that changed their mind, I think, from the student point of view. So the first year we were responsive, to be honest. So we responded to our alumni people. Two of them, two out of the three founders of Doctorib were from EPITA. So they went back to their school and say, hey, there is something in health to do. And we responded by doing this small courses. And when we wanted to make a real one, we went to so we wanted to have a partnership with APHP, so the French hospitals in the Paris region, and it's huge. It's 39 hospitals, I think, so 100,000 people. So how to approach that? The thing we did, we interfaces with the IT department, and we asked them. So we don't know healthcare, we don't know hospitals. Show us what are your interfaces as an IT department into the hospitals. And we have about 50 teachers from the APHP now on our courses. We have got a third of the course of the lectures that are done by medical professionals. I think it's unique in engineering school, and especially in computer science. But the fact is that at the end, we have students that can speak with a medical doctor, and that makes the difference, I think. Of course, they are trained on AI. Of course, they are trained on data interoperability, all that technical stuff. They are at the international level by doing a contest called MICAI on BRATS, which is a brain tumor segmentation contest. So they are at the level from the technical point of view. But that would not be interesting for medical doctors if they don't speak to them at least a kind of broken medical doctor language, let's say. And so we have on board a medical doctor in these courses.
Thank you, Christian. So one of the reasons what we say to feel what are the specific skills seem to be a bit cultural. It's not how to talk with doctors and so on. I have another cultural question, which looks like a bias. I said that less than 30% of digital experts are women. Our panelist does not seem to be very representative of that bias. So I would like first to ask you, Christian, do you have less than 30% women in your training?
Yes, you know the answer. It's less, much less. Unfortunately, women in IT are very first. Women in engineering are very in low numbers. So I think it's about 20% for the engineering school in France. About it's cultural from countries to countries, but in Europe in general, with some exceptions, it's mainly there is a lack of women in engineering, which is strange because there is no barrier It's purely cultural. You don't need any strengths or whatever to be an engineer. So my recommendations is, yes, we need to continue to push for more women in engineering. In computer science, it's even worse. We are less than 5% in EPITA, which is a continuous problem. Since 10 years, we try to attract women. Just to take an example, a real one. We have got about 600 students per year at EPITA. You need to pay for your studies. And what we did, we offered 10 women a free year. It's paid by Amazon, which offers that. And I think if you remove the barrier of the cost of your studies, logically you should have thousands of people coming, and it's not the case. So even if you remove the barrier of the cost of the training, it's not that much. So we have a big problem, cultural problem, for attracting women to engineering and computer science. And one of our plan with the healthcare Majeure is to attract, because in France we have got about 80% of the students that are women in medical sector. We would like to have the one that miss the medical sector to 0.1 point or whatever. Just they are just below the bar. We would like to take them and reserve some places in our healthcare Majeure. Yeah.
Thank you, Christian. Viktoria, at GE, do you also have less than 30% experts, digital experts that are women, or are you balanced? And if so, how do you achieve that balance?
Thank you. It is a very important question. Well, by GE, in our department, 35% is the ratio of women working there, and 30% is approximately the rate of data professionals working by us. So we have a few ladies who transited from medical domain and other IT domains. So we really were proud that we could support our participants, not just with the advices of how to learn programming, and how to become senior data scientists and how to take part in AI operationalization projects by hospitals, but it keeps being provided by senior women experts as well. When it comes to the general rate and interest towards this topic, we had a very good and also interesting experience in this year. So in 2021, more than 50%, so 51% of the participants who joined the Hello AI Risk online program were women. So over 50% in 2021. When it came to the professional program, which addressed senior professionals from the medical domains, that ratio is approximately 30%, so just a bit over 30, but yes. So we meet mostly around this 30% in the industry, but we were happy to see that that the program that addressed young talents, youth researchers, those who are at this stage deciding what should be their next career steps, whether they want to become entrepreneurs or professionals of a given domain, to specialize to radiology or to specialize to bioinformatics. 51% was the ratio of women.
Thank you very much. Stéphanie, on your side, when you organize your conferences or that initiative AI for Health, how do you manage to attract female talents?
That's a good question. Thank you, Alexis. At AI for Health, we have a rule, no panel if there's no parity. So we try with our team to really focus on parity, to have a 50 women, 50 men on our panel, on all the overall bench of speakers that we invite for our conference. What is interesting is that, as Christian says also, is that we have to change the mindset of women, I would say, and men on this in this area. I would say that it's apart from the way of pricing or quota. I think that the challenge is also the education, but it's another topic. But what is interesting in our conference when we invite, it's a concrete example. When we invite a woman on stage, depending on her job or her level of decision, if she's a KOL, key opinion leader or not, that means that if yes, she is used to speak out loud in front of an audience, but if not, we have to ask several times, which is not really the case when you ask to a man to speak on stage, because there's also always this impression of legitimacy. If I don't know very well all the topics, I would not be legitimate to speak on stage. It's like the recruitment also. This is bias, as you said earlier, Alexis. So this is our culture. We try to do it the best and to pick up the speakers who are the most relevant for a topic, and if we can to push a woman up front.
Thank you, Stéphanie. I think we are going to take some questions from the audience, Claire.
Yes, thank you. So we have a first question, which is for you, Christian. Concerning filling the real-life digital gap, is EPITA, for example, offering any online courses or course packages to deal with this issue? So maybe this is about real-world data.
Okay, so about the courses, so the one we do with APHP, the idea would be to make them open as in open source. So we are working on that. So we will extract some conference we have from APHP and make them available free of charge on the web. That's the plan, and that's why we have this partnership with APHP. The idea would be to open the doors from the hospital to the outside world, to show that it's interesting, but after the COVID, once again, the proof is done, and B, that the specialty of each doctor the medical world is a world of specialists. So each doctor has got his domain, and when you look at the full spectrum, it would be very hard for someone to say that nothing of that interests them. Okay, so there's maybe it will be in biology, maybe it will be in COVID tracking, maybe it will be in AI and imaging. It could be on medical device. It could be. So it's so broad that there should be something that interests you.
Thank you, Christian. We don't have other questions from the audience, but I do have one for you, Alexis, maybe, because you didn't get much chance to speak. All of the panelists talked about collaboration and what Stéphanie coined acculturation, or sensibilization. How do you make two? And Christian, you said two worlds that need to speak the same languages. So the way I understand it, it's soft skills. It's attitudes or behavior. Is there any way we can also teach that, or train the two worlds to better communicate?
Thank you for the question. I think that cultural gap that you have between, let's say, hard sciences and medical sciences is real. In our company, for example, any new employee goes to a hospital for half a day, works with surgeons, nurses, doctors, and so on, to understand what are the how it works. What does it feel like having the pressure, having people coming from all parts of the hospital asking questions at the same time, and also getting a sense of the vocabulary. And the second stuff we do is in all our software that we develop, it's compulsory to use the medical vocabulary. We don't use a standard vocabulary. We use the vocabulary that would be used by nurses, doctors, and so on, which in fact makes it very familiar then for developers, head of project leaders, and so on to chat with the doctor because they use the same terms. I think this is the most of the acculturation we have. Also, the co-founder of the company is a doctor, and we always have some medical skills on board because it needs also refining, constant upgrading because it evolves very fast.
Yes, thank you. Maybe one question for Stéphanie and Viktoria. We talked a lot about how maybe there's not enough training programs to train, but what I've been hearing also is that the graduates coming out, they don't stay in Europe sometimes. They go to the US, they go to Japan, to China, wherever maybe they're paid more and they see more value. So I was wondering, Stéphanie and Viktoria, maybe if you had any inputs or suggestions on how we can also resolve this attractivity issue.
That's a complex question, Claire. Because apart from saying that the market and attractivity of the healthcare industry in Europe has to be improved, I would say that also there's the financing, the salaries, wages of recruitment in Europe. I know more in France. I don't know in the other country lots, but I know that this is an issue, and that's why also lots of talents go abroad after the graduation program and go, of course, to China and the US. Not because the studies are better, but because you know that at the end the outcome is different, and that's the reality. It's my opinion. That's my opinion on that.
So, Viktoria, is that also something you experience?
To some extent, yes. The difference with those who we are training in these programs, they basically are coming from Central Eastern Europe and from outside Europe. So for them, finding a job in Europe is much more attractive than maybe for a student from France or Germany. So they are willing to stay in Europe if it's possible for them. So I think that is one aspect that makes a big difference. And what we are hoping for is that what we sense is since the home office became pretty common in the last 1.5 years, so many jobs became remote, and luckily in healthcare informatics, it many times allows these jobs to be turned remote. So it will ease a bit to work abroad, but also it will ease a bit to stay in Europe and do a job that is good for them. So it's maybe tougher for European companies, but there is the opportunity to keep the people at the most attractive and convenient place for them. So it really, I think it's a tough question.
Thank you. I think that concludes the panel session. Do you have any last words, Alexis, as moderator?
No, just to thank our three panelists for their very thoughtful intervention and speech. Thank you very much, Claire.
Thank you. Thank you to you, Alexis, for moderating the session. Thank you to Christian, Stéphanie, and Viktoria. And we now take a break, 10 minutes, and we are back at 3:10 for the last session on the regulatory affairs.